So here at ASCO, we also presented updated results of another study that had been previously presented at ASH a couple of years back. And the study looks at the combination of Epcoritamab with lenalidomide and Rituximab in patients with previously untreated high-burden follicular lymphoma. In the same session, we also presented the first results of another study looking at Epcoritamab maintenance in patients who have received a frontline standard of care therapy for newly diagnosed high-burden follicular lymphoma. And those two presentations were combined. In the first part, we focused on the EPCORE R² study. This was an update with now 41 patients. So this is a phase 1b/2 international open-label trial that explored Epcoritamab administered subcutaneously together with Rituximab and Lenalidomide. The Rituximab lenalidomide portion was given in a way that was very similar to the Relevance trial, whereas Epcoritamab was administered subcutaneously every week for the first 2 months, then every 4 weeks as of cycle 3, and treatment with Epcoritamab continued for up to 2 years. The data cutoff for this updated analysis was January 31st, 2024, and at that time, the median follow-up was close to 23 months. The patient population consisted of patients with newly diagnosed high-burden follicular lymphoma. Of note, a third of the patients had a FLIPI score of 3 or higher. Most patients were in good performance status. The median age was 57 years. And as I mentioned, at a follow-up a time of 23 months, the median number of treatment cycles that was initiated was 23. And the majority of patients were still on treatment at the time of this analysis. We were very encouraged to see that the performance of this triplet combination remained very, very promising at this updated analysis with more patients, and the overall response rate was 95%, and the complete metabolic response rate was 85%, with no patients progressing. The median time to response was very quick, 2.7 months, and the duration of response also very promising, with very few patients losing that complete response, specifically one patient losing it after year 1. What was very encouraging for us to see was that progression-free survival at 24 months was close to 90%, and overall survival was 90% at the 24-month time mark as well. So very encouraging preliminary findings if one thinks about what the performance of standard of care chemoimmunotherapy would be in this space. Obviously, we're eager to see what will happen to those curves with longer follow-up, and we're very hopeful that we won't see any further relapses. In terms of the safety profile, no surprises there. We know that CRS is a predominant adverse event related to Epcoritamab. We saw it in just over 50% of patients, with 15% incidence of grade 2 CRS and no grade 3 or higher. COVID-19 was an unfortunate also occurrence during the study period, which as a reminder was largely during the thick of the pandemic, and the rest of the adverse event profile really recapitulated the single agent experience for each of those of the drugs part of the triplet. We didn't really observe any particular complication from a cytokine release syndrome, including the need for treatment delay or the use of additional therapy, except for tocilizumab that was required in 10% of our patients. Coming to arm 7, that is a smaller cohort. We have 20 patients at the time of this analysis. And these were patients who, as I said, were treated with frontline chemoimmunotherapy. Most of them had received standard bendamustine-based or CHOP-based chemoimmunotherapy, and 60% of them were in complete response at the end of it, whereas 40% were in a partial response. For this arm, we also have a follow-up of over 22 months, and the median number of cycles of epcoritamab given was 9.5. In this particular trial, epcoritamab was given essentially every 2 months for up to 2 years as a maintenance strategy. It's obviously very early, even though the follow-up is close to 2 years. For a maintenance study, we would want to see a longer follow-up to draw any kind of conclusions. However, of the patients treated, almost none lost their response, and most of the complete responses remain complete responses, and many of the partial responses did convert into a complete response, which was one of the anticipated findings of the study as well. Specifically, 83% of patients remain in response, and 90% of patients were alive at the 21-month mark. The safety profile, again, was of no surprise, essentially recapitulating what we saw for epcoritamab single agent in the follicular lymphoma cohort of the pivotal trial, as well as the R-square EPCORE experience that I just described. So in conclusion, I think that epcoritamab combined with lenalidomide and rituximab in frontline follicular lymphoma really yielded very promising results, very deep responses, 85% of the patients with a complete metabolic response. The follow-up is longer than our last analysis, but we will be eager to see an additional, even longer follow-up to confirm these findings. And we're starting to see a chemo-free regimen that can certainly has the potential to rival chemoimmunotherapy. In the maintenance space, I think it's very early. This is a small pilot cohort of 20 patients. We were very happy to see the conversion from partial responses to complete responses, and the fact that in that particular setting, epcoritamab is doable, is safely feasible. Both of these studies constituted the foundation for the ongoing randomized control phase 3 trial testing epcoritamab plus R-square versus standard chemoimmunotherapy in a previously untreated follicular lymphoma.